All right. Hi, everyone. Welcome to Wednesday. It's been kind of a stormy one out there today, but hope all of you are safe. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here just to give you our quick update on COVID-19 this week. So today we're reporting that 98 cases of COVID-19 were added yesterday. That brings our cumulative total to 34,529. We had an increase of 3 deaths, so 3 deaths reported to us yesterday. It's a total of 664 who have died with COVID. And just as a reminder that the number of cases and deaths reported may have occurred in previous weeks, even though they were only reported to us in the last 24 hours. The cumulative number of hospitalized is up 22 to 4,404. And then the number of people currently hospitalized with COVID-19 on yesterday was 174. So that was just a decrease in 1. So it looks like for the past 4 days we've had in the 170s was the number of people hospitalized with COVID. So again, we sort of are hopefully going to continue to go down. Just stalled a few days in the 170 range. And we don't report on the number of deaths by day until we send out the weekly report, because reporting them is somewhat erratic and affected by things that have nothing to do with the date of death. And on the weekly report on figure 8, I think it is, we provide the trend in the deaths by the date of death. So that's really the best place to look at how we're trending with regard to deaths. So just to remind you, that's countywide and actually statewide. The Alabama Department of Public Health and all the health departments around the state and a lot of hospitals are having mass vaccination clinics this week in the 8 public health districts. Mobile is their own public health district, so we have our hospitals are having mass vaccination events. The health department had a big one on Monday. And the rest of this week for the health department, it will be second doses only. So if you received your first dose of Moderna vaccine from the health department at the cruise terminal, then it'll be stamped on your card. Make sure that you check the date on the back of your card and arrive at the cruise terminal, the same place, 4 weeks later from 9 to 2 on weekdays. And if you were vaccinated on a Saturday, come back to the cruise terminal this Saturday between 9 and 5. We still do not have any first dose vaccine to give, so we have not scheduled any additional first dose vaccine events in February. We are still working to try to understand if we're going to receive a regular allotment from the state health department as they make those decisions about of the 600 or so people who are signed up, who gets vaccine on any given week. So when we do have a new clinic to announce, it will be on our website at mchdcares.com. That's where the vaccine information is. Or you can hear a recording by calling 251-410-MCHD. So again, all of the work this week and on Saturday at the cruise terminal are second doses only. And don't show up on any other day than marked on the back of your card. So we need everybody to come back 4 weeks later so that we can make sure we have enough vaccine on hand for the people who need to receive their second dose of vaccine, and so that we can kind of control, know about how many staff members we need and that sort of thing. All right. Bring your vaccine card. If you don't have it or you lost it, then you can come to the terminal, but we'll have to look up your name and your vaccine date just to confirm that in the statewide immunization registry before we can give you a dose of vaccine. So if you forgot your card or you lost it, just be prepared to wait a little bit when you get to the cruise terminal while we verify the information. All right. Just to remind you that the Safer at Home order is still in effect through March 5th. With really no changes over the last couple of times that Dr. Harris and Governor Ivey have refreshed the Safer at Home order. So it requires wearing of facial masks, and then it prohibits non-work gatherings where a physical distance of 6 feet cannot be maintained. So a couple of questions, and then one other kind of thing to mention from CDC today. So a couple of questions. We had received an inquiry. I think someone was doing a story on the fact that law enforcement seems to have a low percentage of law enforcement officers that are electing to be vaccinated. And yeah, we have heard this as well, that there are some groups who are reluctant to embrace the COVID vaccine, even though it has been found to be extremely effective and very safe. So we are doing what we can to try to find champions for vaccine in these different populations, to try to help educate and inform and help people understand the benefit of the vaccine for keeping our essential workers, particularly, on the job. That's really important that you protect yourself. You know, law enforcement is often a very up close and personal interaction between law enforcement and members of the public, and we need to make sure we want them to be as protected as possible. So in addition to getting training in firearms and training in self-defense and training in apprehension and defensive driving, we want you to do what you can do to protect yourself, to stay healthy, protect yourself from COVID-19 by getting a vaccine. It'll keep you on the job and keep our community safer. Let's see, another comment that parts of Alabama have reported not seeing people returning for their second shot. We have not seen this at the Mobile County Health Department. I only have access to looking at the data on immunizations that are submitted by the health department. I'm not able to view data on COVID vaccine administration that have been entered for at other facilities in the county. So what we're seeing at the health department is, by and large, people are returning for their second dose, and we're thrilled about that. It really is exciting to think that this week we will complete the series on a couple thousand people, and again, we'll talk more about that after our week ends, after Saturday. See, and just need to make sure that, we want you to come back 4 weeks later. But if you can't come on that day, then we would prefer to vaccinate you in the few weeks with your second dose as soon as that date is possible. But it can be extended several weeks. I think CDC actually has made some modifications to say it could be as long as 45 days. But to ensure that you get the well-timed protection, that you get protection as quickly as possible, and that we have that second dose vaccine waiting on you, please come back 4 weeks after your first dose so that we can get that dose in your arm. CDC announced today, and I expect very soon we will see the state health department follow, that for people who have completed their 2 doses of vaccine, they're fully vaccinated, and it's been at least 2 weeks since your last dose, that you will be exempt from quarantining if you're exposed to COVID-19 for at least 3 months. So this is, again, a real advantage to getting this vaccine, particularly for healthcare workers, first responders, essential workers. This is why you are prioritized, so that you can have protection, so that you can continue working to support those essential functions in our community. So we really need everyone to do your part and getting the vaccine when it becomes available to you. There are some other conditions around that. I'm giving you the short story, and as I mentioned, I expect the Alabama Department of Public Health will update their quarantine and isolation guidelines based on this CDC guidance that just came out today, to say that people who have completed the 2-dose series, and it has been at least 14 days past their second dose, that they will not be required to quarantine if they're exposed to someone with suspected or confirmed COVID. So that's really good news for everyone who has received 2 doses of vaccine. All right. Let's see, a Facebook question, someone asking if engineers and technicians who work in construction are considered essential workers. And I believe the answer is no, but let's just look back at the list. So right now, those that are eligible include people 65 and older and frontline workers, which include first responders, corrections officers, food and agricultural workers, postal workers, manufacturing, grocery store, public transit, people who work in education, in childcare, or in our judiciary system. So that does not include anyone who's working in the construction industry. And again, I didn't mention healthcare workers, but they're also included in that group. All right, so just another question or two. This one we've been getting a lot this week. So someone asking if the health department is concerned about the Mardi Gras Day or Fat Tuesday, coming up next week, and people that may be gathering in groups to celebrate Fat Tuesday. And yes, this is a concern. We saw our greatest spike in the number of cases following gatherings during the holidays in October and November and December, and New Year's Day, I guess, January as well. And we are just starting to come down from that historic high number of cases and hospitalizations occurring. And I really do not want to see us to lose ground on the COVID transmission in our community. So the only way we can slow transmission is to follow the public health measures outlined in the Safer at Home order. Wear a mask over your mouth and nose. Stay 6 feet away from anyone that does not live in your household. Stay at home if you're sick. Wash your hand frequently. Do not gather. I don't know how many more ways to say it, that it is a fact that COVID spreads through gatherings. And the larger they are, the more spread occurs. And now we're starting to see variants in the state of Alabama, which is more highly transmissible, more infectious. And we don't have a lot of sequencing data out of Mobile yet. So we don't yet know if we have the more infectious variant of COVID-19 in Mobile County. So I would really be disappointed if we as a county, as a community in Mobile, don't do the things that we need to continue slowing COVID transmission in the community. So please consider staying at home, only being around people who live with you, celebrate virtually, find other safer ways to celebrate Mardi Gras and Fat Tuesday than by gathering with large groups of people. All right, so I think that's it for today, and we will be back tomorrow just to give you another update. And everybody have a great evening. We'll talk to you tomorrow.